Have you ever felt a strange flutter in your chest late at night and couldn't quite explain where it came from? A soft, quick rhythm that made you pause and wonder if something was off. A patient of mine once told me she felt perfectly fine during the day, but the moment she took her evening over-the-counter cold pill, her heart began to skip in ways she had never felt before. And I want you to imagine something with me for a moment. Imagine taking a medication you've trusted for years, something you believe is harmless, without realizing it may be quietly influencing the rhythm of your heart. This is a truth many seniors never hear, yet it affects millions of people every day. Some of the most common medications on pharmacy shelves, even the ones labeled extra gentle or non-drowsy, can alter heart rhythm in ways that are easy to overlook. The effects are subtle at first: a flutter, a moment of dizziness, a pulse that feels a little faster or heavier than usual. And for adults over 60, these changes aren't just coincidences. They are often the body's early signals that something is interacting with the heart more deeply than expected. There is a reason this happens. As we age, our metabolism naturally slows down, meaning medications stay in the bloodstream longer than they did in our 40s or 50s. The liver and kidneys, which help clear medicines from the body, work more slowly. And most seniors take more than one medication a day, which increases the chance of interactions that quietly influence heart rhythm. I remember a woman who came to see me after waking up several nights in a row with a sudden burst of heart fluttering. She assumed it was stress or aging. But after reviewing her medications, we discovered the real cause was a new over-the-counter sleep aid she had added to her routine. Once she stopped it, her symptoms disappeared almost immediately. Moments like these remind us how important awareness can be. In this video, we are going to shine a gentle, honest light on these hidden risks. You will learn how certain medications affect the heart, what symptoms to watch for, and simple ways to protect yourself without fear or confusion. If you haven't subscribed yet, I invite you to stay with me and follow Senior Health Daily so we can keep walking this journey of safety, clarity, and confidence together. Why medications affect heart rhythm. More after age 60. When we reach our 60s, our bodies begin to respond to medications differently than when we were young, and the changes are so subtle that most people never notice them until something unexpected happens. The liver that once processed medications quickly now works at a gentler pace. The kidneys, which filter the bloodstream, slow as well. It isn't a flaw or a mistake. It's simply the natural rhythm of aging, but this slower pace means medications linger longer in the bloodstream. A pill that once wore off in 6 hours might now stay active for 8 or 10, and when something stays in the body longer, its effects grow stronger, including its influence on the heart. Many seniors don't realize that even medications taken exactly as prescribed can build up in the system in ways the heart immediately feels. A small increase in drug concentration can tilt the delicate balance of electrolytes, like potassium and magnesium, two minerals essential for maintaining a steady heart rhythm. Slight shifts in these levels can make the heart more sensitive to everyday changes in posture, hydration, or sleep patterns. I remember a woman who came to see me because she felt her heart racing every night before bed. She was in her early 70s, active, cheerful, and proud of taking good care of her health. The palpitations confused her. She assumed they were related to stress, so she tried meditation and breathing exercises, but the fluttering continued. When we reviewed her medications together, we discovered the true cause. She had recently increased the dosage of her blood pressure medicine, and though it helped her readings during the day, it was affecting her heart's electrical system at night. Once her dosage was adjusted, the palpitations disappeared within days. Stories like hers are more common than you might think. With age, the heart's electrical system becomes more sensitive. The pathways that regulate rhythm respond strongly to even mild changes in medication levels. Some seniors describe feeling a sudden skip. Others feel a soft pounding. Some feel a quick burst of fluttering, like a bird trapped beneath the ribs. These sensations can be frightening, especially when they come unexpectedly. But they are often the body's way of saying that a medication has begun affecting the heart more than intended. Small shifts in circulation also matter. Seniors often experience changes in blood pressure throughout the day, and medications that influence pressure can interact with those natural changes. A drop in blood pressure combined with a medication's peak effect can cause dizziness or irregular rhythm, and certain medications that were harmless in middle age can trigger stronger reactions because the heart's sensitivity has increased with time. Understanding these changes doesn't mean living in fear. It means listening to the body with respect and curiosity. When we understand why these things happen, we gain power. We can adjust, adapt, and choose safer routines. The heart is resilient, but it benefits greatly from awareness. Now that we've explored why medications affect the heart more after 60, let's move into the kinds of medications that most commonly trigger rhythm changes. Some of them may surprise you. Types of medications that commonly trigger rhythm changes. Many people assume that only powerful or specialized medications can influence the heart, but the truth is much broader. Even the simplest medications found in every pharmacy aisle can affect heart rhythm. The more familiar they seem, the easier it is to overlook their impact. Cold medicines and decongestants are among the most common triggers. These products often contain stimulants designed to open nasal passages or reduce congestion. While they work well for the sinuses, they can also raise the heart rate and tighten blood vessels. Seniors who take these medications sometimes notice a sudden thumping heart or a racing sensation shortly after a dose. The same ingredients that help you breathe easier can also make your heart work harder, especially if you already have high blood pressure or a history of rhythm issues. Antidepressants are another category worth mentioning. While these medications offer valuable emotional support, some can affect the heart's electrical conduction system. This influence doesn't harm everyone, but in older adults with sensitive hearts, it can cause rhythm changes that feel like fluttering or a sudden jolt. The heart may skip a beat or add an extra one, creating sensations that are easy to confuse with anxiety. Blood pressure medications, ironically, can also cause rhythm changes when the dosage is too high or interacts with another prescription. Medications designed to slow the heart or relax blood vessels might work a little too well in some seniors, leading to dizziness or irregular patterns. For others, the heart may try to compensate for blood pressure dropping too low by beating harder or faster. Over-the-counter pain relievers may seem harmless, but some affect fluid and sodium balance. Even a slight change in sodium levels can influence electrical signals in the heart. Seniors who take these medications regularly, especially during illness or dehydration, may notice palpitations or unusual daytime fatigue. Herbal supplements are another hidden source of rhythm changes. St. John's wort, ginseng, ginkgo, duo, and weight loss teas can interact unpredictably with prescription medications. Many seniors assume natural products are safe, but natural does not always mean gentle. Some herbs stimulate the nervous system or increase metabolism in ways that quickly affect the heart. One of the biggest misconceptions I see is the belief that over-the-counter means safe. I always reassure seniors that these medications aren't dangerous when used correctly, but they are powerful. Every pill affects the body, and the heart is often the first organ to respond when something doesn't fit well. Understanding the different types of medications that influence heart rhythm gives us clarity. In the next section, we explore something even more important: the hidden risks that come from combining medications, timing errors, and everyday habits. Hidden medication risks for seniors over 60. One of the realities of aging is that most seniors take more than one medication. Sometimes it's 2 or 3, sometimes it's 5 or more. And while each medication may be safe on its own, combining them can create unexpected interactions. This is called polypharmacy, and it's one of the most common reasons seniors experience rhythm disturbances. You may not notice these interactions during the day. You may feel perfectly fine. But at night, when the body is resting and medications reach their peak levels, the heart feels the combined effects more strongly. You might feel fluttering as you settle into bed. You might feel a sudden thump in the middle of the night. You might feel dizzy when you rise in the morning. These sensations are your body trying to process the medication load. The timing of medication also matters. Some seniors take all their pills at once because it's easier to remember that way. But taking multiple heart-affecting medications together can amplify their effects. Taking medications with the wrong foods can change how they absorb, making them work faster or harder than intended. Taking certain medications on an empty stomach can increase their potency, creating irregular heartbeat sensations. Habits also play a role. Dehydration is a major factor. When the body lacks water, the blood becomes slightly thicker. This makes circulation harder and increases the impact of medications on the heart. Skipping meals, drinking alcohol, or having a late-night snack can also change how medications act in the bloodstream. A medication that feels fine at breakfast may feel overwhelming at 10 p.m. if taken with a heavy meal. I once had a patient who combined a new sleep aid with her blood pressure medication. She assumed both were safe and unrelated. For several nights, she woke up with heart fluttering and dizziness. She feared she was developing a serious heart condition. After reviewing her routine, we discovered the interaction. Once she spaced her medications apart and adjusted her dosage, the symptoms faded completely. These hidden risks often go unnoticed because they don't produce dramatic symptoms. But the heart feels them. It reveals them through small signs that deserve attention. Let's explore those signs together. Warning signs that medications are affecting heart rhythm. Medication-related rhythm changes rarely arrive loudly or dramatically. They arrive quietly. They show up as chest fluttering when you lie down at night. A skipped beat during a calm moment. A sudden pounding heart while doing something as simple as reading. These sensations may last only a few seconds, but they are important clues. Dizziness is another sign. When medications lower blood pressure too much or change electrolytes, the heart may struggle to keep blood flowing steadily to the brain. Seniors sometimes describe this as feeling lightheaded or like the room moved for a moment. They may feel like their brain fogged for a second, then cleared. Shortness of breath can also signal that a medication is affecting heart rhythm. If the heart isn't beating efficiently, oxygen delivery drops. Seniors may find themselves breathing harder during simple tasks or waking from sleep feeling like they need a deeper breath. Nighttime awakenings are one of the most overlooked symptoms. Many seniors assume they simply sleep lightly, but waking up suddenly, especially with a pounding heart or sense of unease, can be a sign that a medication peak is occurring during the night. Some seniors feel unexplained anxiety. The heart's rhythm affects the nervous system, and irregular patterns can create the sensation of anxiety even when the mind is calm. This is why some people say, "I felt anxious for no reason," shortly after taking a new medication. The most important thing to remember is this. When symptoms appear soon after starting a new medication or adjusting a dosage, your body is giving you information. It is not trying to scare you, it is trying to protect you. Once you recognize these warning signs, you can take simple steps to reduce risk and support your heart. How seniors can reduce medication-related heart risks. One of the most empowering things seniors can do is learn how to manage medications with intention. You don't need to change everything. You just need to understand what your heart needs. Reviewing medications regularly with a doctor or pharmacist is one of the best ways to avoid rhythm disturbances. Sometimes a dosage is too high. Sometimes two medications interact in ways that weren't obvious before. Sometimes a safer alternative exists. Avoiding the mix of prescription medications with over-the-counter drugs without guidance can prevent many rhythm issues. Even something as simple as a cold pill or sleep aid can react unexpectedly when combined with heart medications. Hydration is essential. Drinking water throughout the day helps maintain healthy electrolyte levels, which stabilize the heart's electrical system. Skipping meals can trigger medication spikes, so eating consistently helps keep drug levels steady. Learning which medications should not be taken together can prevent countless symptoms. Many seniors believe timing doesn't matter, but spacing medications properly can reduce their combined effects on the heart. One insight I've shared with many patients is simple but powerful. Small adjustments can create big improvements. Switching a medication from night to morning or dividing a dosage into smaller amounts may eliminate symptoms entirely. Now let's look at gentler, safer alternatives that support heart stability. Safer alternatives and protective habits. Not every symptom requires a new medication. Often, lifestyle habits provide a safer path to comfort and healing. For pain or anxiety, non-drug alternatives such as stretching, slow breathing, or warm compresses may help reduce reliance on medications that affect heart rhythm. Hydration throughout the day supports stable circulation. Eating foods rich in potassium, like bananas and leafy greens, helps regulate electrical signals in the heart. Gentle exercise strengthens the heart's electrical stability. Walking, tai chi, or light swimming helps maintain balance in the nervous system, reducing palpitations caused by stress or medication sensitivity. One habit I encourage seniors to adopt is asking for the lowest effective dose when possible. This simple step reduces side effects and lowers the impact on the heart. Supporting your heart doesn't mean giving up comfort. It means choosing comfort with intention. And finally, it's important to know when the body needs medical attention, especially when heart rhythm changes, feel new or intense. When to seek medical attention immediately. There are moments when heart rhythm symptoms should not be ignored. Persistent palpitations, especially if they grow stronger over time, deserve evaluation. Shortness of breath that arrives suddenly or unexpectedly may signal a medication affecting your heart more than intended. Chest pressure that lasts more than a few minutes needs immediate attention. Fainting or near-fainting episodes are also signs that something in the heart's rhythm has become unstable. If symptoms appear right after starting or adjusting a medication, contact a doctor. Sometimes the solution is as simple as changing the dose. Sometimes another medication is a better fit. Listening to these signs is not fear. It is wisdom. As we bring our conversation to a close, I want you to take a moment and breathe gently. Everything we discussed today comes down to one simple truth. The signals your body gives you are not mistakes. They are messages. They are quiet reminders from a heart that has carried you through decades of experiences, joys, losses, lessons, and loves. When it beats a little differently or asks for attention, it is not failing you. It is speaking to you. The heart is far more resilient than most people realize. Even well into our 70s and 80s, it repairs, it adapts. It responds beautifully to small acts of care. A simple adjustment in medication time, a conversation with your doctor, drinking a little more water, or paying closer attention to how you feel after a new pill. These may seem like tiny steps, but they can transform your comfort, your safety, and your peace of mind more than you know. I hope you also take a moment to appreciate your heart for the work it has done all these years. It has carried you through every season of your life without ever asking for rest. It has continued beating for you through stress, illness, laughter, long nights, and long days. It deserves your gratitude, and it deserves your compassion. If something feels off, trust that instinct. Your intuition has protected you for a lifetime. It will continue to guide you if you listen to it with respect. Thank you for sharing this time with me today. Stay connected with Senior Health Daily so we can continue guiding you toward a safer path, steadier heart rhythms, and a healthier life with more confidence and peace. You are not alone in this journey, and your heart deserves nothing less than your care and attention.